Welcome to Adapting NCLEX. Nurses, if you think NCLEX is all trick question, I say again, think again. In this video, we will tackle NCLEX practice question that seems really tough, right? Until you apply good old-fashioned common sense. If you know how to think like a nurse, you already have what it takes to get these questions right. We're going to use buzzwords, focusing on key aspect of the question, and then let's apply some common sense, and you'll be able to answer these questions easily. Let's get to it. The first one, it look complicated to you, but don't worry. Start reading the question from the back. What is the next priority action? It has to be a priority. That means you have 1 second. The client, what? With the history of Afib, there is a reason why I gave you atrial fibrillation. Report what? Sudden onset. This is a new problem altogether of what? Shortness of breath and chest discomfort, right? And I give you vitals. Heart rate of 108, blood pressure 92/58, and respiratory rate of 24. Think about it. I have an Afib patient. All of a sudden, he has shortness of breath and chest pain. But the vitals I've given you, tachycardic, right? 108, you say, okay, that's normal for Afib. Blood pressure 92/58. That's not normal for patient with what? Afib. And a respiratory rate of what? 24. Do something for this patient. What would you do? Do you give that patient oxygen? Do you place the client in a high follow position? Notify the healthcare provider or obtain 12-lead EKG. You have to put everything together and then say, look, if I'm in this situation using common sense and buzzword, I'm going to do one thing. There's acute change in condition of the patient. What do you think? Of course, the patient has shortness of breath, right? The respiratory of 24. Well, oxygen is not a bad thing. But I'm telling you, oxygen is supportive. It's not a life-saving thing all the time. Place the client in a high follow position. They always tell you, patient has shortness of breath. I'm using this as a clue that people see shortness of breath and then they forget about the rest of the question. It's common sense. Placing the client in high follow position, oh, it's going to help with the breathing. Of course, then you forget about the blood pressure. Why would they give me shortness of breath and blood pressure? If I sit this patient up, blood pressure is going to worsen altogether. Do I call the doctor and don't do anything or obtain 12-lead EKG? The time is going to take to obtain EKG, patient is already dead. Afib, sudden onset of pulmonary change, and what? And then discomfort. This is not a long problem. And there's a clue. I did not give you the patient saturation. Why would I not give it to you? Because I'm trying to tell you, you can use common sense. There's no saturation here. That means oxygen is not going to provide anything to the patient. Shortness of breath has nothing to do with the respiratory status. It's all probably patient has Afib on all of a sudden having signs of lung issue. It may be heart problem, pulmonary condition secondary to probably decompensated heart failure from Afib. That's why the cardiac output is low. Use your common sense. Don't give them oxygen. Don't place them in high follow position because you know they say every time you patient has a shortness of breath, lift them up. But this question is just does not apply. Don't go with those things. Look at the question, apply a common sense, go with the buzzword, and then you'll be able to answer this question. You should notify the provider because this patient condition is changing, it's desaturating, he's having airway issue, having a lung issue due to what? Cardiac problem. You need some help. Let the doctor know. Like I said, these are common sense questions. Number 3 is your right answer. Same thing. What is the best next action? A laboring client with the history of sexual trauma. There's a reason why it's there. The board wants you to focus on it. Begin crying and ask the nurse to stop the cervical exams, right? Patient is having exams. He said, stop it. What is the best next action in this situation? explain that the exams is necessary for labor progress. Well, yes, it's good. If I don't examine you, I don't know how much is your progress. How far are you? Pause the exams, ask the client to describe what is bothering her. Okay, that's good. Stop. Okay, but ask what is going on. Stop the exams, provide privacy, and offer emotional support. Notify the provider that the client is not compliant with assessment. Of course, number 4 is really out there. There's nothing wrong. You can do something before calling the doctor. The patient is compliant. It says stop. Gently explain the exams is necessary for labor progress. It's a trap, right? What is this question is asking you? Is asking you about autonomy, trauma, intended, informed consent. Patient said, don't examine him. Me, you know it. Don't get trapped. It's a common sense. If you see a patient and they say, don't touch me, you should not touch the patient. This is what I've turned it into this question. A bunch of words. Patient is having labor. I use labor as an example, but I said, stop. Don't examine me. I don't need cervical exams. You should not traumatize this patient anymore. It's a basic patient respect, test-taking strategy, and common sense. If you continue, you're violating patient autonomy. So don't re-traumatize the patient, right? Informed consent is completely gone when she says stop. Therefore, I know pause is there, but asking them more questions is traumatizing, right? Explaining that they are in labor is a trap because patient in labor, we are keep on examining you, but don't do that. Stop the exams, provide privacy, offer emotional support. But you can eliminate all the answers if you go back to the basics, common sense. Don't touch me, then let me go. So number 3 is your right answer. And this is same thing, this using the same strategy to help you. Which intervention should the nurse implement first? There's a reason why I said first, one thing first, right? A nurse is caring for a terminally ill client who become increasingly restless and moaning softly. This is words I want you to pay attention to. There's a buzzword there. Terminal illness, restlessness, and moaning. What would you do? Common sense wise, hey, restlessness, I got to put some small pillow under the client head to help with the position. Lower sensory stimuli in the room. That may probably agitate the patient more. Provide gentle hand massage that is trying to calm the patient. Place familiar personal items near the bedside so that when they see, it may help with their restlessness or moaning. But this is the key. Common sense wise, there's a reason why I'm telling you the patient has restlessness and moaning. But then go back to your content. In your end of life care videos, I have a bunch of them, watch them. When you see a patient who is in end of life care or terminal illness, as soon as you see restlessness, think about stimuli, sensory stimuli. So this question is asking you to figure out what causes the restlessness and moaning. But yeah, okay, position. We all see that every time. Restlessness, improve the lung function. Hey, put a small pillow so that you can have the airway. I never told you he's having airway. Gently massage. This is also giving you a clue that this may be related to the calming the patient down. Familiar object is almost the same, but the buzzword there is restlessness and moaning in the terminal ill patient, and the content is sensory stimuli. So calm them down, provide quiet environment, figure out what is making them agitated and moaning because they are in the terminal state right now. And this is how they behave. So putting a small pillow under their head, I know a lot of people will pick that because they see the word restlessness. Step back, look at the question and see why would they do that to you. Then under that, they put sensory stimuli. I'm picking it. Number 2, I'm leaving the pillow for long problem away. Number 3 is not the right answer. 2 is the best way. Now, this one is straight up common sense answering selection. You don't expect your board to give you 100% clue in the question. They want you to think, right? That's why I said, don't let these questions trap you. Which of these clients would most benefit from room assignment near the nursing station? Every time you see that something should trigger in your head, why would I put the patient in the near nursing station? Probably safety question. Either they're pulling some IV, they're going to fall, they're going to commit suicide. Safety. I cannot tell you in that question, but you got to apply this little common sense. Therefore, a 45-year-old with pancreatitis on PCA, it's a trap. You know he has a pump. Hey, so if you walk, he's going to fall. But you can walk with PCA. You've seen the patient before. There's nothing in the question that make this patient high risk of fall, right? 83-year-old, give the question away. Then he has dementia, right? But try to trap you. Patient can ambulate independently. That is still not enough. It's an older patient, yes, dementia. Can start doing things you don't know, may trip on things. That patient need to be near anesthesia. 17-year-old is young. He just had surgery. He want to go home. I don't think he need to be in a nursing station. A 60-year-old with diabetes, there's nothing worrisome about that. You see, don't go for the things that will trap you. But look at the whole totality of the question. He said, 85, 83-year-old, I don't know. There's something there. I got to pick it. What should the nurse do first? Same thing. The nurse enter the room and find a client with trach who is what? Cyanotic and gasping. The trach is dislodged. Those are the bars. I have trach has come out. I have cyanotic and gasping. The first thing should come to your mind, common sense, right? Oh, I've lost my airway. Fine. What would you do when you lose your airway? You call the rapid response people, or do you attempt to reinsert it back? Or do you apply oxygen via face mask, or use a bag mask over the nose and mouth? Think about it. Patient is gasping for air, and he has lost the source of oxygen that he was getting through the trach. What would you do? Calling rapid response tell you you're trying to bring more up, but it's something you can do before calling them. Attempting to reinsert the trach tube is the trap. I never give you how many days the trach has been there. If it's less than 7 days, then yeah, you should not put it back. More than 7 days, you can put it back. There's nothing in the question telling you. Don't make up things in the question. I intentionally omit it. What would you do? Don't put it back because there's nothing, you don't know how long it is. Apply oxygen via face mask. If you lost trach and you put face mask, they need forceful oxygen. You have to basically put air in their lung because the patient is cyanotic, is gasping. You're looking for oxygen. The best answer is bag mask it. You have a control over how much oxygen go in and out, not putting oxygen on them. This is key. Thinking about by elimination, you can think about it like number 4 is better than all of them. And this is another one. I said this question to make it try to not hard, but let you just step back. I want you to always, when you read a question, pull back so that you don't have tunnel vision, broad vision, and then look both at your peripheral and your tunnel vision together, and you'll be able to see the buzzword will pop up, and the key answer will be sitting there. It's a pick me, which finding is most concerning. And this is caring for a client receiving TPM via central line. That's all. It's getting feeding through central line. Which one, what do you see that should be concerning you? You know, when somebody have central line, number 1 is infection. That's all, right? And I tell you, blood glucose is what? 138. Well, you can tell yourself, your TPN 138, it's not 500. Cap missing from the central line port. If there's no port, the cap is missing, egg may go through the port, or maybe infection, bacterial source right away. I don't like that. Embolism and infection. Weight gain 1.5 in 3 days. Then you bring your car and say, why would they use 1.5 in what, 3 days? There's something else you know. That one, you need at least 2 to 3 pounds in what? in that short time to see if the patient is fluid overloaded. A yellow fluid visible in the tube. What color is the TPN? Don't tell me this is a pus. The color is yellowish, Sometimes it depends if you're getting lipid, right? Lipid is white, but yellowish, that's what the TPN is supposed to be. Don't pick number 4. You say, yellowish, it's something infection. But then if you step back, you say, whoa, TPN is yellow. The only thing that is missing is number 2. If you don't know it, pick it. Don't be nice. I've eliminated 1, 3, and 4. I'm picking number 2. So 2 is the right answer. This is another one. If you have problem with this question, I want you to look at it again and again and again. What should the nurse do first? A nurse walks in the client's room and find them slumped over in bed, unresponsive, and a pulse of 38 and respiratory rate of 10. This is test-taking strategy, but at the same time, buzzword using what? Common sense. Common sense, right? CPR, call the doctor, initiate oxygen, call rapid response. First of all, number 1, look at it. CPR, why would you choose CPR? Patient is unresponsive. Okay. But I give you patient has a pulse. 38. Pulse of 38, it means patient has pulse. It does not matter the number. Okay. A pulse is a pulse. All we check is, can I feel a pulse? That means if I feel a pulse, the heart is pumping. A pumping heart does not need what? What do you think? Does not need what? What do you think? Chest compression. That's all. Number 2, call the healthcare provider. Can you do something before calling the healthcare provider? Patient is unresponsive. The code that we do, the first thing is we always say ABC. But the first thing when you see a patient unresponsive, is assess them and see, hey, are you okay? Are you okay? So that's what the nurse has done. That is why she'll be able to know that the patient is unresponsive. So you say, are you okay? Check for responsiveness. Then you check a pulse, and then you see if they're breathing. So do you call the doctor at this time? It's a waste of time. Oxygen is not going to fix this patient. Oxygen is not going to fix patient. After checking for responsiveness and a pulse and a respiratory rate, you need some help to fix this patient. You got to call rapid response. These are common sense, but you have to guide yourself to say, why would I do CPR? If you pick the answer, always ask yourself, why would I do that? But when you see pulse, you know that it's not going to help this patient. CPR in the pulse, patient who has pulse is irrelevant. So, number 4 is the right answer. A client with diabetes is due for lispro insulin. The breakfast tray hasn't arrived yet. What should the nurse do? You see, this is the same thing, content, but at the same time, common sense. Patient need insulin. I don't know what is lispro. I don't care. Okay, I don't know what is lispro. There's 2 ways you can answer this question. There's a reason why they put it there, but then they told you there's no tray. Fine. They want you to have a little bit content. At least if you're taking the NCLEX, you should be able to recognize lispro. That is a fast acting. As soon as you recognize it, the rest is the common sense. Am I going to give the insulin as scheduled? Whoa, it's a fast acting. Hypoglycemia. Patient is in trouble. Call dietary and give insulin right away. Do you know when they're going to give them, they'll bring the food, they're going to take their time, take the elevator, it will take them ages to bring it. That's why there's a reason why there's no food there. Well, if you call them, they're going to waste their time and do the same thing. Hold the insulin until food is available. That is the most safest answer there. Patient has no food, and I'm going to give them fast acting. Well, if you're hungry, you're not going to eat anything. Offer juice and administer oxygen. Is that what is the best answer? offer juice and administer oxygen is not safe, right? You don't know, the juice may not be enough glucose for the patients to what? Use. If you give them insulin juice and then you infuse insulin, it's a trap, right? You may drop their glucose. It's not enough amount of sugar. It's a temporary relief. They need a full diet to be able to, if they need insulin, full diet, and then you give them their insulin. Giving them juice and say, here is your insulin, will not carry them. It's a fast acting. Whatever glucose you give them is going to get out of the system. When they eat, they have all kind of sorts of food ingredient that will take time to be breaking down protein later on if they need the glucose. So don't be trapped with that. Number 4 is a trap. I don't want you to pick it. If you do that, it's a problem. So 3 is the best answer. The next, a toddler found and ate a few pills from a purse. The child is awake and playing. What is the next first action? Step back. Once again, you can see this is all common sense. You tell you, hey, the kid took my purse, he took some pills and eat. But what is the kid doing? Awake? He's just joking around. What would you do? Common sense. Okay. Am I panicking here? Or I got to know, focus on there is a reason why the last sentence is telling you, is a red light telling you, awake and playing. Notify the provider. Okay, that's not bad. Call the poison control. Okay, that's not bad. Ask what the pills were. Okay, that's not bad. Monitor vital signs every 15 minutes. Well, that's not bad. Well, why will you be monitoring vital signs? That's the key. Because you worry about something happening. You don't know what is going to happen. If you don't know what is going to happen, then figure out what the patient took so that you can preemptively treat it. Common sense. Therefore, calling the poison control, they're going to ask you what medication the patient took. Calling the air care provider is going to ask you, do you know what the medication the mother was taking and the kid took? You see how they connected? Ask what the pills were, and then you can treat it. You can't fix the problem if you don't know what the kids took. Number 3 is your right answer. Number 10. This is also a trap. A client on contact precaution want to walk in the hallway. Contact precaution. You can walk in your hallway, right? Yes. Right? Is that what you're supposed to do? Think about it. What should the nurse do? Contact the infectious control so that they can help you figure out what to do with the patient who is in contact precaution. Explain why the client might stay in their room. Tell them, hey, you're in contact precaution. Stay in your room. You can't leave. Is that what you should do? Provide a clean gown and assist them outside. Is that friendly? Request an order for a physical therapy instead. Patient want to walk away. Common sense, number 4 is gone. Contact infectious control. They will expect you to know what you're supposed to do. Explain why the client may stay in their room. Of course. And this is the key. Isolation is not confinement. Every time you see infectious control question, let it be in your head. Isolation is not confinement. Therefore, precaution is not isolation from movement. Once again, isolation is not confinement. That's because you are in isolation. Doesn't mean we can confine you. Nobody can visit you. So if you see visiting questions and all these things, let this come back. Isolation is not confinement. That is the key. Second thing, precaution, okay, is not equal to isolation from movement. I can still move. Now you know the answer, right? Of course, explaining they cannot stay in the room is not true. Just because I have contact precaution and been confined in my room for the rest of my life, no. They can go outside. It's not, even if you have airborne precaution can go get an x-ray. You see the content. You should not limit yourself, but sometimes apply common sense. So you've seen a question before, a patient who had airborne precaution is going to get x-ray. Therefore, why would not the contact precaution patient get out of the room? Give them a gown and then assist them. Basically, protect others while preventing isolation from the patient. So let them come out, but protect the others by covering the patient, and then let them walk. This is the bonus question. A diabetic client report feeling shaky and has a glucose of 60. What is the best initial response? Think about it. Short question, but it requires some common sense, right? Feeling shaky and glucose of what? 60. I've given you symptoms. Don't overthink it. I'm telling you, the patient glucose is 60, even though it's not 59. You know, glucose of 60 is low normal, but I'm telling you, something is happening. The normal does not mean anything. 60 here, but now I'm shaky. That means I have symptoms. If you have symptoms, you are diabetic. Fix the problem before the patient go into coma. Calling the doctor is not going to help you. Rechecking the glucose will be 10. Give orange juice because patient is symptomatic even with the glucose of 60. I know I'm supposed to hold the next dose of insulin, but that's too late. The question is asking you initial response. Initial response. Give the orange juice. This is adapting class. This is the second video I've made. I'm going to do 3 more because somebody asked about how to approach this question in a common sense way. You may not know the content, but step back, no tunnel vision, bring your peripheral vision, add both together, and say, if I am the patient, this is what I want. If you like video, share. If you want to join our on-demand or our membership on YouTube, you get more content like that. Or you can just subscribe and get free video so that when I make a video, you'll be notified. Put your notification on because YouTube will send it to you right away. But if you want, besides concise content, I have a crash course and on-demand site with the QBank. Take care of yourself and good luck. If you are in nursing school, good luck. If you are taking your NCLEX, good luck. Keep charging as always. Bye.